Hello there, my name is Patrick Kelly. I'm with the DuPage County Green Party, and welcome to the second Social Justice in DuPage Forum. And tonight's topic, as you know, is about single-payer health care. It's a very hot topic in the news. So with that, I will introduce our moderator tonight, Matt Reichel.
We have a very talented panel here today. I'd like to thank everybody for coming out to have this discussion. It's very pleasing that we're finally having this discussion in the United States. It's about time.
Well, one of the things that is being created into a big bugaboo about national health care or single-payer is these death panels. And, you know, they've used this framing of death panels. But we already have those, as far as I can see, with administrators denying, in insurance companies, denying therapy. I would just, like your thoughts on that.
This is very near and dear to my heart because my wife does end-of-life counseling to her elderly homebound Medicare patients. She is made aware of their wishes on how they want to leave this world. And all this House Bill 3200 is doing is they're going to actually start to pay primary care physicians some money for this time spent on end-of-life counseling. And it's not to speed up the end of life, but it's to pay the physicians for doing this work that they do now for nothing.
As a candidate, I'd like to step in here. I don't think we should engage this insidious fear-mongering coming from this far right-wing minority that instead of engaging in civil discourse is out to disrupt these town hall meetings. And I was inspired earlier this week to see a video of Representative Barney Frank in Massachusetts where some woman got up and was comparing Obama to Hitler somehow, that extending medical care to more people is somehow Nazi-esque, and he just told her, ma'am, having a conversation with you would be like having a conversation with a dining room table. It's a waste of my time. That's exactly how we should deal with these people. They're incapable of rational argument. It's not worth our time to stoop to their level. As Rich mentioned, we have the majority behind us. What we need to do is the political organizing and not worry about this insidious messaging.
So I guess I would disagree with Mike a little bit in the sense that I agree with the framing thing is very important. The problem with answering the death panel thing is you don't want to give it credence in answering it. Now, something that's very similar to that is the whole thing about rationing, right? We hear a lot about that. Oh, we don't want ration care. Well, very similar to your argument. We have rationing now, 48 or whatever million people are rationed completely out of the system. So there's some of your rationing right there. And of course, we're rationed by profiteers who have a profit incentive to try to knock you out of claims. So we have that anarchistic type of rationing that's not based on the merits of it. Now, it is important to realize any single-payer system is not a panacea, and I don't think anybody's arguing that. Single payer in and of itself is not going to solve every problem. Decisions will have to be made. And you could underfund the system, and there's a constant battle. I mean, there are places where they've had single payer and they don't fund it well enough. And this is a favorite tactic of the right too, right? First you get government power, then you underfund the public schools, and then you say, oh, the public schools aren't working, we need to privatize them, or we don't give enough money to Amtrak. We don't want to waste money on railroads, right? But that's because they underfunded them. And you can give example after example of this garbage where they do this. So simply having a single payer system itself is not, it's the beginning of a solution, but it's not the whole solution. You have to make sure it's adequately funded. You have to make sure it's adequately administered. But what it really boils down to is this. The idea of any kind of insurance is you have some kind of middleman between yourself and your health care provider that you're paying into a little bit at a time so that when something bad happens, you don't have to pay a lot when you're sick or injured and can't afford it and can't pay it. That's the idea behind any kind of insurance. The real question is, do you want to have that middleman be someone who has a profit incentive to deny you coverage, or would you rather have a public entity that is publicly accountable, that even when they do screw up, at least you have some recourse?
I'd like to pose this question because I came from Australia where the employer did not pay health insurance, okay? And I come to the US and the employer is the only one paying it, almost. Now, when the employer's paying it, the employee doesn't know the true cost. I remember talking to someone and they said, well, you have health insurance? I said, yes, it costs me $50 a month. And that's their out-of-pocket, right? But the employer might be paying $1,500 and they're paying $50 of that $15. They think health insurance is only $50 a month, right? So they really, what's happened is the individual has been shielded from the true cost of health insurance, right? If you put out, I'm just sort of talking off the top of my head, if you put a proposal out there, why should employers pay health insurance, right? You probably have a lot of companies that would say, yeah, that's right, why should we pay it, right? Because what happened in Australia was everyone was paying it on an individual basis. And so they were asked, would you like to keep paying health insurance or would you like the government to pay it? And what do you think they did? Government, you pay it, right? And that's why universal health coverage was introduced so easily in Australia, because the individual had to pay for it. So if you had some sort of groundswell to get rid of employers paying for it here, you'd have everyone on board with a single plan. The other thing too is that insurance, if you have life insurance here, you pay the same amount every month, and then if you die, you get the payout at the end, right? That's insurance because you're insuring against something that's coming up in the future. Health insurance really is not really insurance, because the way it works is when you get sick, your premium goes up. They don't take into account that you've paid for 15, 20 years when you were well. They don't take that into account and say, well, we're just going to draw on all those premiums you've done from the past, and you're going to continue paying level insurance for the rest of your life. They don't do that, so it's not really insurance. But a single payer plan is true insurance because everyone's been hit with it and they're paying the same flat rate through their life, whether they get sick or don't get sick. That's really true insurance. But health insurance, that we call it health insurance in this country, I don't think is really insurance.
So thank you everybody for coming out and participating.